Really so scared of the needles. Don't let me say anything stupid to mom and dad.
You have a cat?
Wait, do you not remember that we have a cat?
No.
What? You got me the cat. Ice cream?
I just want to cuddle. So now that you're all looped up, Alan, I know you're gonna be truthful. How many girls are you talking to?
Do you have a girlfriend right now?
Who is your least favorite in the group? I'm not a part of this. Hello everyone, my name is Dr. Mo and I'm a general dentist. I will be reacting to Stokes Twin video of getting my wisdom teeth removed. I have removed a whole lot of wisdom teeth and I'll be critiquing what happened throughout this process.
I literally haven't had anything to eat or drink in over a day, and that's because I'm on my way right now to get my wisdom teeth out.
So it's not that unless instructed by your healthcare professional, I'm not sure from where he got this from that he needs more than a day of not eating or drinking. The reason that your healthcare professional may instruct you to not eat or drink for an X number of hours prior to the procedure is primarily in relation to the anesthesia that they're going to administer. In a sense, that like sedation or general anesthesia may be used, they need a clear airway and nothing like regurgitating from the food or to avoid any potential obstruction of the airway. Oh, I just noticed. So why is a handpiece thrown on the patient like this? So this is actually quite dangerous. I would never do this. I don't know if it's by mistake or they're in a rush.
Are you scared at all? Like, how are you feeling?
To be 100% honest, I'm terrified. I don't know why. They're actually knocking me out, and that is what scares me. Because I keep having nightmares that I didn't wake up from this surgery.
You know what, Alan? This isn't fair. I should be doing this with you as your twin brother. That's what I've been telling you. I needed a guinea pig first, Alan. I'm terrified. I'm terrified. Thank you to Tanner for volunteering to drive us there. It was actually over a 2-hour drive, so thank you, Tanner.
Oh.
Thank you.
Volunteer? You guys forced
Actually over a 2-hour.
Holy, oh my God. Did they just show a 6-hour drive to reach a healthcare professional to remove your wisdom tooth? Holy crap, oh my God, it's crazy actually.
Drive, so thank you, Tanner. Can't say that. Hopefully they let me in the operating room with Alan because I really want to be there for him. I'm going to feel really bad if he goes through this by himself. I'm going to need you to hold my hand while we're there the whole time. I'll be there for you. So just like how I was for your surgery, I was holding your hand the whole time. All right.
Oh, that's really sweet.
Alex, I think I should head in now for it's too late. Where are we? Should we go through the back? Where are we at? Here.
tooth hurty. Getting his tooth. Never mind.
Hello?
Hi, Alan. This is Audrey from Dr. Gabe's office.
Yes, so I won't be coming in anymore. Like, I got too scared.
Oh, okay.
No, I'm totally joking. We're on floor 10 right now, walking in. Hello. Sorry we're late. Tanner took us to the wrong spot. Oh my God. So many needles. I'm literally so scared of the needles. I just remember one time when we got surgery, we were getting surgery.
So normally in my clinic, we're really careful as to how visible the needles are to patients, especially prior to the procedure. Of course, at some point, we're using the needle or administering the anesthesia, and they may see it. However, some patients have needle phobia, and the ones who don't have an actual condition of needle phobia may be terrified when they see the needle.
Circumcised, and they like.
Then you're gonna take a little nap, and then when you wake up from your little nap, those little wisdom teeth will be gone. All right. Is this the guy that made you guys late?
Yes, it was.
How you doing?
I'm all good, man. How are you?
Good, good. Hey, did you know an apple a day keeps the doctor away?
Okay.
Doctor, dentist.
He's a dentist.
Wait, are dentists not doctors or what? My degree is Doctor of Dental Surgery.
You know, it's supposed to be both of you originally. What's going on?
I'm not going to lie. I am a little scared, and I wanted him to be the guinea pig.
All right. Well, listen. How many likes?
Yeah, so he's just gonna do a trial, checking what happens with his brother, and then he will go forward.
What would it take for us to get you to do your surgery?
No.
Why is he trying to get the brother to do everything?
I will never. I'm not. I'm too scared. I'm honestly too scared. No amount of likes will get me to get my wisdom teeth removed.
All right. What if we hit 1 million?
If this video actually gets 1 million likes, guys, then I will actually do it. But it's not.
And that's a sign for you to hit the like button. Let's get it to 1,000 likes in this video.
Not gonna get 1 million likes. So yes, it will. Yes, it will. It'll get 1 million. Watch. I believe in you
I'll
guys.
see you in a
Yeah,
week.
Whoa, that's a big needle.
Guys,
As I said, they're literally doing like some moves with their needle. I mean, we'll try to hide its visibility. As I said, at some point we will use it. Some patients don't care, needle or not needle, meaning they don't care when they see it.
scared. I'm not even starting.
I'm scared, but I'm also scared because we're about to hit 10 mil. So maybe by the time I wake up from the surgery, you guys will have already gotten us to 10 mil. Will that make you feel
Don't forget to subscribe to Dr. Mo Dentist channel.
better, Alan? If you wake up to 10 mil, that would make me feel a little bit better. But right now, I'm just feeling a lot of fear. Don't let me say anything stupid to mom and dad. This thing might rip.
So they're checking their vitals. It's very important to check the vitals, blood pressure, so forth, and these things prior to any extraction, not only when we have a wisdom tooth extraction or when there is IV sedation, because there are critical points, we rather call them cutoff points, for blood pressure, for example. If it reaches a certain number, then at near, or rather beyond this, we will not go for an extraction. There is a specific number for emergency extractions and one for routine and so forth.
Because I've been working out.
So after a wisdom teeth removal, best to avoid any vigorous exercise or activity and to rest. So definitely to not do what was going on. So they're inserting the IV station needle, I guess. Oh, so I'm not sure why. Are they not using gloves or what? Yeah, looks like they're not using gloves, which I'm very surprised. Why would you not use gloves when you're inserting a literal intravascular IV needle?
You okay?
Oh.
Note a very important thing that following also, or rather along with the IV sedation, they're giving a local anesthesia. And the reason is, or one of the reasons we do this is because the local anesthesia has additional benefits as it contains adrenaline. Adrenaline helps with the bleeding control, makes the anesthesia more effective, more potent, and also of a longer duration. There are anesthetics without adrenaline, and they have their indications of use.
So me and a dentist.
Okay, so they just showed 4 wisdom teeth removals. Again, I'm saying this in a lot of the videos I'm reacting to. Whenever they go to removing all 4 wisdom teeth, at least hopefully all the wisdom teeth are indicated for extraction. Now I saw on the shirt looks like periodontics, implant, etc. So again, they have expertise in surgery. Definitely the like a healthcare professional in the periodontics department, they know how to extract teeth very well because they study extensively all the structures that are surrounding your tooth and supporting bone, all these things.
So me and a dentist decided to pull a little.
Also, implant specialists must know how to, or I should know at least. So some people focus with the word how to remove a tooth very carefully, and the term we use is atraumatically, right? Which is the opposite of traumatically, to preserve the area for an implant. Now, this is relevant to wisdom teeth because we're not going to place an implant there in that context. However, wisdom teeth, of course, should be removed atraumatically and as safely and minimally minimally invasive as possible.
Prank on Alan. But before Alan wakes up, we are flying out one of you guys to hang out with us for an entire day and be in a whole YouTube video. And all you have to do is be subscribed. First thing he does is put on lip balm.
Oh.
Lip balm, as in to moisturize the lips. Your lips could get dry following a procedure where you open your mouth for long periods of time.
What? I'm here. Alan, are you ready?
You want to start the procedure? We can start now if you want.
Yeah, so a common dentist joke. So, by the way, write in the comment section below, which ones do you think are worse, the dentist jokes or the dad jokes? So one common joke we have is after finishing the entire procedure, we may say, do you want to start now? So it's just the dentist joke.
Are you ready to start it? Alan, we're just kidding. You're already done. You're done.
Yeah.
Yeah, it's out.
Is that my tongue? Oh my god.
So of course they're feeling numbness and they're showing them they removed the wisdom teeth. Now I'm not an advocate of this. I'm against this because there are some patients with phobia from blood and phobia from things like, removed teeth can really terrify them and it can knock them out, meaning they could faint when they see removed teeth or blood or so forth. So I don't advocate doing this. Now, maybe keep a record or something, of course, for the clinic that you remove the tooth, etc. But I don't think it's that important to show the patient.
I feel so weird. About that was it.
I prefer yogurt ice cream and soup.
So he's just advocating a soft diet. Of course, immediately after the wisdom teeth removal, you should not be eating for at least roughly an hour or drinking because the extraction socket is still fresh.
That's good. I sound like John talking. I can't breathe.
You can't breathe? Are you okay? Wait, just calm down.
I don't know what's going on. I don't feel good.
I'll give you a piggyback. Right.
I don't feel good.
So what they're replacing here looks like coal, right? It's written cold on it, so it looks like coal packets. And the reason for this is because cold application helps with the reduction of the swelling, and they're tying it up in this way so that a bit more pressure is applied, and also the patient perhaps too tired to stay like this holding them.
I'll give you a piggyback, right? I'm gonna carry him all the way out to the car.
Yeah.
Bye, guys.
That's not tongue.
She's biting on that.
No. Want it on?
That's a different one.
You could beat me in a one-on-one in basketball? What? You want some ice cream?
I want a hamburger.
Hamburger?
Well, he can have the sausage.
Whoa, Sean, whoa.
Not at a time like this, Sean. We do have some very interesting questions to ask you in a little bit, and we're also driving you.
So the gauze are filled with blood. Normally, following the removal of a tooth, any tooth, not only wisdom teeth, I would provide the patient with additional gauze in case the old ones that we placed get flooded with the blood and fluids. They can replace them with the new gauze that we provide.
Down to go see some of our friends, and they also have some very interesting and juicy questions to ask you. Okay, Alan?
How can I help you?
Alan?
Ice cream vanilla.
I'm sorry?
Ice cream vanilla.
Vanilla cone?
Yes.
There you go.
Let's start it up for it.
Are you ready? Thank you.
There you go.
What?
She thought, I guess, that he was messing with her or something, so she gave the other person completely ignored.
I'm having a hardest time eating ice cream right now. I can't even eat ice cream.
You're gonna get a brain freeze.
Oh, you go on now.
So we're gonna try to make him feel better by laughing. Alan.
So again, what he's trying to apply is like a cold application.
Have a cat?
Wait, do you not remember that we have a cat?
No.
What? You got me the
Can
cat.
I just hear your laugh, Tanner?
Do you want to go home or do you want to see some of our friends first?
Some of my friends.
Hopefully they can cheer him up and make him feel a little better.
How you feeling?
I feel so bad.
Oh no. All right, well, here, I have some questions to ask you. All right, so I have a couple questions for you. You have a girlfriend right now.
No, I don't.
You don't?
Mm-mm.
You're not lying to me, are you?
Mm-mm.
You're being honest?
Yeah.
Do you have a boyfriend? What are you laughing about?
Alex does.
Alex does?
Mhm.
Does he like me?
I think so.
I never.
Anyway,
Yeah, I think she's a looking one.
There's wisdom teeth out.
Look at our friends pretending to care.
We do care. You should get some like dirt on Alan though right now.
Whoa! Alan is my friend.
And then you give him little thingies to
Gauze
do.
and
Alan.
But he's like,
He's like fully conscious.
only thing that'll help the pain is a kiss, Lexi.
Alright, so we have a few more questions to ask Alan. Okay. Do you like me or Brent better?
Recently knew Brent more in the past.
Aww. Do you think I'm funny? Yes? Was anybody expecting that answer?
No, it wasn't.
Mm-hmm.
It is? He actually hasn't eaten in 2 days. He's not allowed to eat the day before the surgery and the whole rest of the day.
So he's probably like starving right now.
Yeah, he is.
Too.
Allowed to eat the day before the surgery and the whole rest of the day.
So he's probably.
so again, I'm not sure about this day, like the entire literal day beforehand. Again, just follow your dentist, oral surgeon, or healthcare professional instructions. Normally, it's set number of hours prior to the procedure. These could be long hours actually, but in entirety, I don't know, a bit exaggerated. Also, didn't he say the rest of the day? It's not like this. It's not like the rest of the day, but definitely there are some diet considerations. I have video about this on my channel. You can check it out.
Probably like starving right now.
Yeah, he is.
Shoot. Then you should have been the one to get your wisdom teeth out.
I would have lost like 10 pounds.
That's enough.
Not your best friend.
Sorry, it's my best
Why do they all look like TikTokers or something?
friend.
Oh!
It's just
I didn't. Dude.
Bro, what happened? You good? Oh.
Are you good?
For you.
Really?
Mm-hmm.
Wow.
Are they saying that for everyone? Because honestly, when the truth comes out, when you're like fucked up as he is, who's the funniest?
I think Alex is.
That's kind of biased.
Yeah, hey, other than me.
Either you or Andrew.
Who is your least favorite in the group?
Been to Alan.
Oh my gosh, are you serious? Oh.
What? Do you even know what happened?
Did he get his wisdom teeth out or something?
Yeah, he did.
Why is it all swollen?
Are you all loopy?
Mm-hmm. Why is
Honestly, the swelling is not that bad. I've seen much worse.
Dave Charles here?
Of course, there is fatigue, there is malaise following wisdom teeth extractions. It's exaggerated here for YouTube video purposes.
Oh my god!
Alex, you didn't get your wisdom teeth taken out?
No, I was too scared, so I made Alan do it first.
Well, you should have got your wisdom teeth taken out so you can lose a few extra pounds.
Cat, that was so mean.
No.
That was mean.
Cat, I don't appreciate you keep calling my son fat.
Oh my god. You guys.
Hey, Dad.
What, son?
Dad.
Hey, Alan, I promise you I wouldn't let you say anything stupid in front of Mom or Dad, okay?
Oh, I hope he says something stupid.
So now that you're all looped up, Alan, I know you're going to be truthful, so I have a few questions to ask you.
Mm-hmm.
How many girls are you talking to?
Just one.
One.
Mm-hmm.
Who is it?
It's not you.
If I whisper, you let me know if I'm right or not, okay? I knew it.
Mom and Dad are gone. I think Dad has a crush on Mom.
I was there holding your hand during the entire operation, giving you piggyback rides.
I don't remember.
Yeah, to be fair, the guy in the white shirt, he was very considerate of the guy in in the other shirt. I don't really follow their videos, so excuse my ignorance. And that being said, thank you everyone for watching. That's all for today. Don't forget to like, turn on the notification bell, and Dr. Mo Dentist out.